Welcome to the podcast. My name is Dr. Noor Gajraj. How much should we really exercise? Recommendations. The Centers for Disease Control and Prevention and the American Heart Association recommend at least 150 minutes of moderate intensity aerobic activity per week, like brisk walking or leisurely cycling, or 75 minutes of vigorous intensity aerobic activity per week, such as running or swimming laps. You can also do an equivalent combination of both. In addition to aerobic exercise, it's recommended to include muscle strengthening activities for all major muscle groups at least 2 days per week. These guidelines are the result of decades of robust research. They are based on extensive systematic reviews, meta-analyses, and large-scale epidemiological studies that have consistently demonstrated a clear dose-response relationship between physical activity and health outcomes. Researchers have meticulously analyzed data to understand how exercise impacts cardiovascular health, reduces the risk of chronic diseases like type 2 diabetes and certain cancers, aids in weight management, improves mental well-being, and ultimately contributes to increased longevity. These recommendations are considered the minimum to achieve substantial health benefits, a foundation for a healthier life. The evidence strongly suggests that for many, exceeding recommendations can indeed provide additional advantages. Studies indicate that going beyond the minimum, sometimes 2 to 4 times above the recommended amount, leads to a further reduction in the risk of cardiovascular disease and all-cause mortality. For example, some research points to a 26 to 31% lower risk of all-cause mortality and a 28 to 38% lower risk of cardiovascular disease mortality for those exercising 2 to 4 times the recommended moderate physical activity. Higher levels of activity also offer greater protection against chronic diseases and can be particularly helpful for significant weight loss and may lead to even greater improvements in mental health and longevity. The physical activity guidelines for Americans even state that additional health benefits are gauged in physical activity beyond the equivalent 300 minutes, 5 hours of moderate intensity physical activity per week. However, it's crucial to understand that there's a balance. While the benefits often increase with more activity, there are important considerations and potential risks of excessive exercise. Pushing too hard, too fast, can lead to an increased risk of overuse injuries like stress fractures or tendonitis. There's also the risk of overtraining syndrome, which can result in persistent fatigue, decreased performance, hormonal imbalances, and a weakened immune system. In rare but severe cases, extreme exertion can even lead to rhabdomyolysis, a dangerous breakdown of muscle tissue. Move naturally. Integrated movement. People in blue zones live in environments that nudge them into movement without conscious effort. Their daily routines inherently involve physical activity. This includes activities like gardening, walking to neighbors' houses or to the market, using hand-operated tools for chores instead of modern conveniences like dishwashers or washing machines, and tending to farms or cultivating their own food. Opting out of conveniences. They often forego modern conveniences to reduce physical effort. For example, instead of driving, they walk. Instead of using elevators, they take the stairs. And they perform manual household tasks. This continuous low intensity movement throughout the day adds up significantly. Purposeful activity. Their physical activity is often tied to a purpose, such as maintaining their homes, growing food, or engaging in community life. This makes movement a seamless and often enjoyable part of their existence, rather than a separate scheduled workout. In conclusion, while meeting the standard exercise recommendations is vital for substantial health benefits, there is compelling evidence that exercising more can offer even greater advantages, especially in reducing the risk of cardiovascular disease and premature death. The keys to increase your activity levels gradually. Listen to your body and prioritize adequate rest to avoid injuries and overtraining. The optimal amount of exercise is truly individual, depending on your current fitness level, health status, and personal goals. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to the channel.